This video is one of the series produced by the Georgia Department of Public Health. Its purpose is to provide training for non-clinical volunteers to enable them to perform basic health care tasks and take pressure off professional medical staff in the event of a wide-scale emergency. Every hospital is different, so check with your supervisor to learn about protocols that are specific to your hospital. While watching this video, please remember these things. As a non-clinical volunteer, you will not be called on to perform any clinical task or to make judgment calls on patients' treatment needs. If you encounter anything unusual or something that you don't understand, you should immediately consult a registered nurse or another healthcare professional. The Georgia Department of Public Health appreciates your help and thanks you for volunteering. Before feeding a patient, you must first consult with the nurse. Encourage the patient to wash their hands as well. Then you must confirm the patient's identity. Check the patient's ID bracelet and make sure it matches the name on the dietary card, which is located on the food tray. Next, make sure that the head of the patient's bed is elevated to at least a 45-degree angle. Place a towel or napkin over the patient's chest. Now wash your hands and set up the food tray on the patient's table. Make sure the food isn't too hot or too cold. When feeding the patient, use a spoon for safety and alternate between solid and liquid foods. Use straws for liquids unless you have been instructed otherwise by the nurse or the patient chooses and is able to drink from a cup. Don't rush the patient. Let them eat at their own pace and allow time for proper chewing and swallowing.
Mr. Smith, talk to me.
If the patient begins to choke, turn them on their side and call for help immediately.
Well, maybe after you get through eating, we'll let you sleep a little bit.
You should talk with the patient about pleasant things and encourage the patient to eat as much as possible.
I see you drank all the milk, almost all.
When the patient has finished eating, record the percentage of food eaten on the I&O sheet.